Dear viewers, we have been joined in the studio by our next guest for this evening, Dr. Ghanem Alsalem, the consultant internal medicine and gastroenterologist. Good evening, Dr. Ghanem.
Good evening, and thanks for having me on.
Thank you so much for being here. Of course, it's our pleasure to have you with us on Hala Kuwait.
Thank you very much.
Thank you. So to start off, what is dyspepsia? Can you tell us about it?
Yes. Good to have you to talk about this dyspepsia on the show. This show is very familiar, famous show in Kuwait. There's a lot of people follow this show, so it's good to discuss this kind of symptoms or terminology for patients and for the people to understand.
Yes.
Dyspepsia is just basically indigestion. That's when you eat, you don't digest the food in the right way or in the normal way, let's say.
Right.
The patients, they come with dyspepsia, they have a lot of symptoms. They don't know what's going on with them, and they try to seek medical help to find what's wrong with them. So they eat, and they find the food is not processing in the right way. Because they compare themselves to the others, and they find the abnormalities. So we call this in terminology dyspepsia.
And personally, from interviewing a lot of doctors, I have never heard of this term or of this disease. So I'm glad that we're talking about it this evening.
Of course.
Just from talking with you right before we went on air, it seems like it's a very common issue.
It is. It is. Actually, most of the patients who are following in the gastroenterology clinic or in the family medicine clinics, they do complain of GI symptoms, let's say the GI tract. And it's between dyspepsia or IBS, irritable bowel syndrome. So most of these symptoms actually because of these two conditions, which by the way, they are very common in our community in Kuwait and worldwide as well.
So how can we differentiate? I'm understanding it could be really similar.
Yes.
How can we know if it's dyspepsia or IBS? What are the symptoms that set them apart?
Sure, that's a good question. Let's say dyspepsia, for simple term, for everybody to understand, because it's complicated to go into details. But in simple terms, IBS, irritable bowel syndrome, is your colon and the lower part of your GI tract. The dyspepsia is your upper part of the GI tract, your stomach, your esophagus, and your duodenum. These are the small first part of your intestine. So the dyspepsia, patients will come with, let's say, feeling heaviness when they eat. Sometimes they come with reflux symptoms. They come with sometimes pain, burping, uncomfortable after food. They eat small amount and they feel there is a heaviness inside, like there's 5 kilograms in their tummy. Or sometimes they feel gases inside. They feel they cannot walk, they cannot talk, they don't want to do anything, they just want to concentrate on what's happening in their bowel. So that's dyspepsia. It's a group of symptoms, comes to the patient after food or without food, and they feel uncomfortable with their life.
Makes so much sense. So what are the risk symptoms of dyspepsia? What should we expect if this goes untreated? Yes,
so dyspepsia, you need to know what's going on inside. So there are things cause dyspepsia. We need to investigate them to find out maybe there is underlying cause we can treat. Some of the patients we don't find any underlying cause, and that's most likely what we call the functional dyspepsia. So these patients, they don't have any disease going on, they don't have anything stopping them from digesting food, but they do have this abnormalities in their digestive tract. And in these patients, we do give them treatment to make them more comfortable. Now, what are the consequences if you don't treat it? Sometimes you don't gain weight. Some patients like to have dyspepsia, so they don't get weight, especially
women. I'm guessing.
Yes. And sometimes actually there's no serious side effects or complications associated with dyspepsia if it is functional dyspepsia. That means there is no underlying cause. But I have to emphasize, you need to see your doctor to find what's causing your dyspepsia.
Perfect.
And for this matter, I want to pay attention. I want everybody to listen to me this. If you have these 3 symptoms, you don't have dyspepsia, you have something serious. If you're vomiting blood, or if you see blood in your stool, if you lose weight significantly without a cause, without an explanation, or actually if you sleep and you wake up from pain. So pain wakes you up from sleep. These are 3 symptoms. You really need to see a doctor because they are not simple dyspepsia.
Makes sense. So these are the alarming symptoms that we shouldn't just rule out as my food is not doing well in my tummy. So you said it might be a bit hard to diagnose dyspepsia. How is it diagnosed and how is it treated? What's the treatment plan?
Good question. Now, To diagnose dyspepsia, first we need to sit with the patient and take a medical history, and that you go to your doctor, you tell them the symptoms, and the doctor will ask you a lot of questions to try to figure out, make a plan, make a diagnosis for what's going on. And then the doctor will start to do clinical examination. They will examine your tummy, they will examine your system and see if there is any other abnormalities in your body to cause dyspepsia. Then your doctor may ask you to do some investigations. So we need to rule out what is the commonest cause of dyspepsia is the infection with H. pylori, Helicobacter pylori. This kind of bacteria actually invades your stomach and makes the stomach sick. So you feel this kind of dyspepsia or these symptoms. And you need to investigate for the H. pylori with different things. We can do a blood test, we can do a breath test, we can do endoscopy.
So many things.
The other thing is we need to rule out other causes of dyspepsia because it could be side effects of medication. So we need to look into the patient if they take medications, if they take hormones, if they take painkillers, or if they take anything else. The other thing is dyspepsia, you see it common with other medical conditions, for example, for patients with thyroid disease or with hormonal disease.
Okay, I did not know that.
Yeah, and other patients, maybe ladies, if they are pregnant, they come with dyspepsia symptoms. Some patients, they have serious matters. For example, they may have gallstones in their gallbladder and they need to be removed. Some patients may have pancreatic problems. So we need to sit down. It's a complicated system. It's not simple. The symptoms are annoying, but the diagnosis is very important. So we need patients to come to the clinic and start to tell the doctor everything they feel. From there, we take it all, and then we look for the cause of the dyspepsia, and we try to treat it.
So what are the complications that we're looking at? What can happen? So let's say I found out I have dyspepsia and then I got lazy. You know, I'm not seeing my doctor again. What am I looking at?
Yeah. So if you have underlying cause, for example, if you have the H. pylori, the infection, this will stay with you for a long time. And the H. pylori infection can cause a lot of complications. What we fear most is the ulcers. Patient may present with ulcers. That's mean breakdown in their stomach, and they may bleed from the ulcers. And then when they bleed from the ulcers, it get complicated, and then they will go maybe to ICU or something else. So we always tell the patient, seek medical help, because the doctor will help you to avoid these complications. The other thing, if the patient is having gallbladder stones, for example, they will have complications from the stones, and if they do, they may get infection, and they may go to the ICU, or may they go somewhere else. So we need to rule out the gallstones. Anything can cause the dyspepsia with pathology going on inside your bowel, hormonal, infection, mechanical cause. These are the people we want to look for them and try to get them out and seek and help them to fast and treat them quickly so they don't get complications. So I repeat again, the symptoms where I want everybody to understand them. If you have them, you need to come to the clinic immediately. Bleeding, either from up or down. If you lose weight, or if you wake up from sleep from pain, you need help.
That's your really bad complications, red flags.
That's when you actually beyond the dyspepsia, now you get the complication, the red flags.
Of course. So with what we're talking about, I'm understanding that these are issues that maybe an 18-year-old and above will come to you with. Should we expect dyspepsia with younger people, children, teenagers? How does that work?
Very good question. I'm getting this question actually lately. Let me tell you something. Dyspepsia can affect anybody, male or female, any age.
Any age.
Especially recently after the COVID crisis worldwide, we are seeing this in young patients. We wouldn't see this before as much as we are seeing it today. And the reason is because most of the functional dyspepsia, those who don't have pathology going on, they have what is stress, too much thinking, afraid, scared from the COVID crisis, and they may actually have school problem, they may have social issues. They do have dyspepsia symptoms. Their symptoms comes in a form of abnormal feelings in their stomach, abnormal feeling when they eat, they feel full, they feel gases, they feel uncomfortable. So we actually seeing it in younger age, but we see it mostly with those in the middle age, let's say. If we see dyspepsia symptoms in elderly, like above the age of 55 or 60, or I wouldn't say elderly, but above the age of 55, we actually say this is alarming sign as well. Because usually you see it below the 55. Those who are working, those who are stressful, above 55 should be relaxed, should be enjoying their life as much as as they can. So if we see symptoms of dyspepsia above the age of 55, we urgently advise them to see a doctor, because it's one of the alarming symptoms.
Of course. So, doctor, you mentioned a few ways that we can diagnose dyspepsia, so breathing tests and other things.
Yes.
But the common thought that all of us have is that we need an endoscopy, and we all freak out when we hear that. We get really scared. We don't want to see the doctor. Is this a must?
Yes, exactly. That's a good question, because I don't want people to be afraid. We don't do endoscopy for everybody. But endoscopy is part of the investigation we require to diagnose patients. For those who have the alarming signs, those who don't respond to treatment, we give patients some treatment to relax them first. So we divide the treatment in three main things. Maybe we give them something we call proton pump inhibitor. We may give them antacid. We may give them the H2 blockers. These are the three main categories of treatment. I know it's a medical term, but I want people to understand in the medical term. So you go to your doctor, they will tell you maybe we'll take proton pump inhibitor, and they give you a trial of 1 week, 2 weeks, 1 month, and see how you respond. If you don't respond to these treatments, they may advise you for endoscopy to see what's going on inside your stomach. So endoscopy not for everybody. Endoscopy mainly for those who have alarming signs or alarming symptoms, and those who don't respond to treatment, or those who are above the age of 55. Now the endoscopy, after saying all that, is a simple procedure. It's not something to make people afraid of. We give you some sedation. Some patients don't like sedation. We can do it without sedation, but most of the patients they like sedation. It's up to you. So we give you light sedation. It's 5 to 10 minutes procedure. We look inside. We pass the camera through your mouth. We look inside your stomach and see what's going on in there. We may take some tissue biopsy to look into the cells in the lab to give you better diagnosis. It's a simple procedure. The complication rate with endoscopy is very, very low, and I advise patients, if your doctor advises you for endoscopy, go for it.
Don't be scared.
It's fine. Yes.
Definitely, as you said, it's a very minor procedure, and there's not a lot of discomfort that comes with it. So is there any way that we can avoid dyspepsia, or having it, or growing into it, let's say if we don't have an underlying condition?
Yes. So for those who have dyspepsia and they don't have underlying conditions, two main things: your diet, your lifestyle, exercising. So we tell them, you need to change your lifestyle.
Yes.
Because dyspepsia comes from bad habits. Comes from eating too much fatty food. Comes from eating, with a bad habit, you eat late at night.
That's true.
Now today is the winter time in Kuwait. It's very fun.
Perfect time for kashtat and late night food.
Exactly. You eat 3 times at night. Oh, that's too much. So you make your stomach sick. It cannot tolerate that amount of money. If you want to eat healthy food. Eat fruit and vegetables. They will do the job. They stop you from feeling hungry, and it's light for the stomach. But if you eat fatty food, you eat a lot of food, fast food, a lot of that, it will cause dyspepsia. The other thing, if you don't do exercise, we advise patients to do exercise. If you walk half an hour every day, 5 days a week, you have 7 days, 2 days off, 5 days you do some kind of exercise, walking, jogging, swimming, anything like that. If you do it more than half an hour, it's perfect. If you can't, it's okay. But at least half an hour every day. Try to avoid bad habits like smoking. Smoking is really bad, and it can cause dyspepsia. And now we have a lot of kind of smoking. Shisha, e-cigarettes, flavors, a lot of things. And we advise them to stop smoking, because smoking is actually one of the factors can make dyspepsia worse, and it cannot go away even with the treatment.
And that's contrary to people's beliefs that after a meal I need nicotine. So I'm glad you did mention that, Dr. Ghanem. Thank you so much. It was my pleasure.
Thank you for having me on, and I wish everybody a great health. Keep your stomach good. You will have a great life.
Thank you. This was really informative, and hopefully we'll get to see you back on Hala Kuwait. Thank you
very much.
Dear viewers, we had with us Dr. Ghanem Alsalem, the consultant internal medicine and gastroenterologist. And up next is a report. Let's view it.